Welcome to our channel, where we share knowledge and solutions to help enhance health and improve the quality of life. Kidney stones can appear without warning, and when they do, the pain can be one of the most terrifying experiences you've ever had. Many people only discover they have kidney stones when it's already too late. But the important thing is that we can fully prevent and treat them if we understand them correctly. With over 1 million new cases worldwide every year, kidney stones are one of the most common health issues that you can't ignore. And if you think kidney stones only affect the elderly, you'll need to change that mindset after watching this video. From simple causes to modern treatments, all will be explained in this video. Let's explore how you can protect yourself from the pain and dangerous complications of kidney stones. 1. Introduction to kidney stones. Kidney stones are small, hard stones that form in the kidneys when minerals and salts in urine crystallize and stick together. The formation process begins when substances such as calcium, oxalate, and uric acid don't fully dissolve in the urine, forming hard crystals. These stones can gradually grow into a large mass, causing blockages in the urinary system if not treated in time. Kidney stones can form anywhere in the urinary system, from the kidneys and ureters to the bladder. While some stones may not cause immediate symptoms, if not detected and managed early, they can lead to more serious problems for kidney health and the urinary system. Kidney stones are not only common among the elderly, but can also affect young people, especially when dietary habits and lifestyle are unhealthy. 2 types of kidney stones. Kidney stones can be classified based on their chemical composition. Each type of stone has its own characteristics, and the treatment methods will vary accordingly. Here are the most common types of kidney stones. Calcium oxalate stones. These are the most common type of kidney stone, accounting for about 70 to 80% of cases. Calcium oxalate combines with oxalate, a naturally occurring compound found in foods like spinach, cucumbers, and certain nuts, to form hard crystals. These stones can form when the calcium level in the urine is too high, or when the body cannot absorb oxalate properly. Calcium phosphate stones. This type accounts for about 10 to 15% of kidney stone cases. Calcium phosphate stones form when calcium combines with phosphate, typically occurring when the urine has a high pH level. People with metabolic disorders such as hyperparathyroidism or urinary tract infections are at a higher risk of developing this type of stone. Uric acid stones. Uric acid stones form when there is too much uric acid in the urine. This type of stone is common in individuals with a diet high in purines, found in red meat, seafood, or those with gout. Uric acid stones may not be visible on an X-ray because they do not absorb X-rays, so diagnosis often relies on other tests such as a CT scan. Struvite stones. These stones typically form due to urinary tract infections, especially caused by bacteria. These bacteria break down urea in the urine, producing ammonia and phosphate, which then form struvite stones. Struvite stones can grow rapidly, forming large masses known as staghorn stones, which can cause significant damage to the kidneys. Cystine stones. This is a rare type of stone that occurs in people with cystinuria, a genetic disorder that prevents the normal absorption of cysteine, an amino acid, by the body. Cystine stones tend to form in individuals with higher than normal levels of cysteine in their urine. Each type of kidney stone has its own unique characteristics and requires different treatment methods. Correctly identifying the type of stone is crucial for applying effective treatment, which may include dietary changes, medical interventions, or surgery if necessary. 3 symptoms of kidney stones. When a person has kidney stones, they may not feel symptoms immediately. However, as the stone moves or becomes obstructed in the urinary system, symptoms begin to appear and are often very painful. Renal colic is the characteristic symptom, typically starting from the lower back and extending to the lower abdomen and groin. The pain is intense and fluctuates continuously, resembling cramps. This is one of the worst types of pain many people experience, and it can last anywhere from a few minutes to several hours. Kidney stones can also cause blood in the urine, making it appear pink, red, or brown. This indicates that the stone may be causing damage to the tissues in the urinary tract. In addition, obstruction caused by the stone can make it difficult to urinate, with sensations of painful urination or frequent urination. This is a sign that urine flow is severely impacted. urine may become cloudy or have a foul odor, especially if there is a urinary tract infection present. This is a sign of infection and requires prompt medical intervention. Additionally, nausea and vomiting are common symptoms due to the renal colic irritating the digestive system. This condition can worsen if the patient is unable to eat or keep food down. Finally, if an infection occurs, the patient may develop a fever, a sign of serious infection. High fever is often accompanied by chills and fatigue. These symptoms need to be addressed quickly to prevent dangerous complications for the kidneys and overall health. If not treated early, kidney stones can lead to kidney failure or sepsis. 4. Diagnosis of kidney stones. The diagnosis of kidney stones begins with evaluating the patient's symptoms and medical history. However, to confirm and accurately determine the type of stone, various diagnostic tests and imaging techniques are required. The diagnostic process typically includes several important steps, from clinical examination to advanced imaging techniques. First, the doctor will conduct a clinical examination to gather information about symptoms, such as renal colic, painful urination, or the presence of blood in the urine. Additionally, blood and urine tests will be performed to measure levels of calcium, oxalate, and uric acid in the body, as these factors can be linked to kidney stone formation. One of the most accurate and commonly used diagnostic methods is a CT scan, computed tomography. This technique provides detailed images of the kidneys, ureters, and bladder, identifying the location, size, and type of stone. A CT scan not only helps detect kidney stones but also allows the doctor to rule out other conditions with similar symptoms, such as tumors or infections. Ultrasound of the kidneys is also a useful diagnostic tool, especially in cases involving pregnant patients or children. While ultrasound may not clearly detect uric acid stones, it helps identify larger stones and assess the condition of the kidneys, ureters, and bladder. However, ultrasound cannot precisely determine the type of stone, so it is often considered a supplementary method. Additionally, X-rays can be used to detect calcium stones, as these can appear clearly on X-ray images. However, uric acid stones will not show up on an X-ray, so this method may not always be effective. To precisely determine the type of kidney stone and its underlying cause, the doctor may request an analysis of the stone sample if it has been removed. Analyzing the stone helps identify its primary composition, which can guide the appropriate treatment approach. Correctly diagnosing the type of kidney stone is crucial, as each type requires different treatment and prevention methods. 5. Treatment of kidney stones. The treatment of kidney stones depends on the size, location of the stone, and the patient's overall health. The goal is to reduce pain, remove the stone, and prevent recurrence. For small stones, less than 5 millimeters, doctors usually opt for a watchful waiting approach. The stone may pass naturally through the urine, and the patient is advised to drink plenty of water to facilitate this process. Pain relievers such as NSAIDs or paracetamol can help alleviate pain when the stone moves. If the stone does not cause pain or blockage, the patient may be encouraged to continue monitoring and self-care at home. For stones larger than 5 millimeters or those causing blockage or infection, more invasive treatments may be required. Extracorporeal shockwave TRIPS ESWL uses shock waves to break the stone into smaller pieces, making it easier to pass through the body. ESWL is a common and minimally invasive method, but it is only effective for stones of moderate size. Ureteroscopy is another method that uses a thin scope to break the stone with a laser or specialized tool. If the stone is too large or other methods are ineffective, nephrolithotomy, kidney stone surgery, may be performed to remove the stone. This surgery is typically used for cases where stones are difficult to treat. Supportive medications, such as tamsulosin, can help the stone pass more easily. For calcium oxalate stones, doctors may recommend potassium citrate to prevent stone formation. Additionally, maintaining a healthy diet with adequate water intake and limiting foods that contribute to stone formation plays an important role in preventing recurrence. A key part of treatment involves dietary changes. Patients should drink enough water, avoid foods high in oxalate, reduce salt intake, and limit foods rich in purines to lower the risk of stone formation and recurrence. 6. Prevention of kidney stones. Preventing kidney stones not only helps reduce the risk of forming stones, but also prevents serious health issues related to this condition. Changing one's diet and lifestyle plays an important role in minimizing the risk of developing this disease. One key factor is drinking enough water. Drinking plenty of water helps dilute urine, reducing the chances of minerals clumping together and forming stones. Patients should drink at least 2.5 to 3 liters of water daily and drink whenever they feel thirsty. A healthy diet is also crucial. Patients should limit foods high in oxalates, such as spinach, nuts, chocolate, and certain fruits like oranges and watermelon, as oxalates can form calcium oxalate stones. Additionally, it is important to reduce salt and purine-rich foods, such as red meat and seafood, as they can increase calcium and uric acid levels in urine, which can lead to stone formation. People at high risk of kidney stones should avoid caffeinated and carbonated drinks, as these can increase calcium levels in urine. Studies also show that weight loss in obese individuals can help lower the risk of kidney stones. In addition to diet, regular exercise is an effective method for maintaining kidney health and reducing the risk of disease. Maintaining a stable weight and avoiding deficiencies or excesses in nutrients can help reduce pressure on the kidneys, lowering the risk of stone formation. Finally, for those who have previously had kidney stones, using preventive medications may be an effective option. Drugs like potassium citrate help prevent calcium oxalate stones, while thiazide diuretics can reduce calcium levels in urine. In conclusion, preventing kidney stones involves healthy habits such as drinking enough water, eating a balanced diet, exercising regularly, and maintaining a healthy weight. These habits help protect kidney health and reduce the risk of kidney stones in the future. With the knowledge and preventive solutions you've just explored, you can now take proactive steps to protect your kidney health from kidney stones. Don't let seemingly small issues lead to serious consequences. Share this video to help those around you understand how to protect their kidney health. Don't forget to subscribe to the channel and turn on notifications so you don't miss any other helpful videos in the future. Thank you for staying with us until the end of the video. Wishing you good health, and remember, a healthy habit today will help you have a bright future free of kidney stones.